Hello friends, welcome to Dream PG YouTube channel. This channel will discuss about high yielding and most repeatedly asked questions for those who are preparing for medical PG entrance. If you didn't subscribe our channel so far, please do it and click the bell icon next to it to receive notifications. Feel free to click the like button and share your comments. Hello friends, today we will discuss about important points in APGAR score. What is APGAR score? APGAR score is a quantitative method to assess respiratory, circulatory and neurological functions in newborn. A stands for appearance, P stands for pulse rate, G stands for grimace, A stands for activity, and the R stands for respiratory effort. Each category has 3 scores, 0, 1 and 2. So the total APGAR score is 10. Appearance wise, blue baby is given a score of 0. Whereas when the body is pink and the extremities are blue, score given is 1. And if the baby is pink, full score is given. Let's look into pulse rate. When the pulse is absent, score 0. Pulse rate is less than 100, score is 1. Pulse rate greater than 100, score is 2. When there is no response from the baby, 0 score is given. Grimace present, score 1. And when the baby cries or cough or sneeze, score 2 is given. Regarding activity, if the baby is flaccid, score 0 is given. If there is some flexion, score 1 is given, and if the baby is actively moving, score 2 is given. When there is no respiratory effort from the baby, score is 0. If there is a slow and irregular respiration, score is 1. And if there is a good cry from the baby, that means the respiration is good, score is 2. This APGAR score is evaluated at 1 minute after birth and 5 minutes after birth. Normal score is 7 to 10. If the score is between 4 and 6, there is a mild depression, and if the score is between 0 and 3, there is severe depression. If the APGAR score is less than 3 at 5 minutes after birth, repeat assessing the APGAR score at 10 minutes, 15 minutes and 30 minutes, and if the APGAR score is less than 3 in all these stages, there is a high chance that the baby will lead to cerebral palsy. Let's answer this question. Which among the following is not a component of APGAR score? Option A, color of the body. Option B, muscle tone. Option C, respiratory rate. Option D, heart rate. Yeah, that's it guys.